everybody, my name is Denisha Whitley. This is my presentation on hepatitis C. Today I'll be discussing the different aspects of hepatitis C as it relates to public health. Let's get started. What is hepatitis C? Hepatitis C has been defined as an inflammation of the liver. It's caused by a virus that is actually the hepatitis C virus. It's transmittable through blood contact, meaning that if someone who is infected with hepatitis C were to inject their blood into someone who was not, that person will become infected themselves. The symptoms of hepatitis C could include swelling of the legs, dark colored urine, jaundice, which is a yellow discoloration of the skin and eyes, as you can see here in the picture, easily bleeding. There's more symptoms that do arise with hepatitis C that aren't presented here, such as ones that include like fatigue or nausea, but these are the main ones that you will find with hepatitis C virus. The incidence rate for hepatitis C, as of now, it is proclaimed to be 2.4 million people who suffer from hepatitis C alone in America. This number continues to climb only because people under the age of 30 are starting to show more cases, which is kind of making the incidence rates rise a little bit. To see here, for an example, I wanted to show you the state of Montana. In Montana, a city called Powell, the incident rate is the highest throughout the entire state, mind you. There is 979.1 per 100,000 people who are infected with the virus. Next is the mortality rate. Hepatitis C, since it is related to liver issues and damage, and it's a chronic disease, the mortality rate is considerably rising, and it is fairly high. As you can see here from the death numbers from hepatitis C liver-related problems alone has gone up from 111 to 284, and that's between the years of 1997 to 2012. These numbers indicate that the numbers of death caused by liver-related issues due to hepatitis C are becoming more prominent. The mortality rate itself is 0.2 to 0.3 per 100 persons a year, so it equals out to about 284 people dying each year from liver-related deaths caused by hepatitis C. The prevalence rate is 1.6%, which equated to about 4.1 million people being infected globally. This is based upon the hepatitis C virus being traceable, RNA being traceable in people who have contracted the virus. Whether it's chronic or just an acute, that is the rate, 1.6, which equates to 4.1 million people. And that number continues to climb, like I said, so due to the incidence rates continuing to climb and the death rates continuing to climb, this number is also going to continue to climb until unfortunately, we find some way to stop the spreading of hepatitis C. As for who is infected, it seems as if at one point in time, the most infected people were what are called baby boomers. These people were born between the years of 1945 and 1965. Um, with this number, there is a prevalence in race, which you can see as African Americans. They are the leading cases for hepatitis C virus. They're also the leading deaths due to liver complications caused by hepatitis C virus. Um, but that's what was written in 2020. But there has been a known rise in cases of hepatitis C virus in women of African American descent around the ages of childbearing ages, maybe between 18 and 30. That has gone up 22% since the years of 2011 and 2014, which kind of shifts the WHO is getting it, because now we're seeing younger and younger people infected with hepatitis C. No longer can we just say it's a baby boomers disease or infection, because now we're seeing it more prevalent among people who are under the age of 30, as opposed to people who are in their 60s and closer to 70, the baby boomers. The reasons that these infections are notably so high in these communities, it has been said that this is due to unprotected sex and people using bad needles when experiencing drug use. Um, and it is, I mean, it's safe to say that childbearing women, of course, they're not really participating in protected sex if they're bearing children. And drug users, it's prevalent among them because, yes, it's a sad fact, but yes, there are a lot of people addicted to drugs, and they are not practicing safe safe uses, or they're sharing needles and poor hygiene, which all contributes to becoming infected with hepatitis C. Lastly, it's pretty unfortunate that we have no vaccine for this virus as of yet. The government has been working on trying to establish one. However, there are vaccines for hepatitis A and B. We just haven't gone as far as making a vaccine for hepatitis C yet, but with hopes in the future there will be. But as for now, the only thing that us as a society can do to help people with hepatitis C or to prevent it is to do educational drug programs that could be ran throughout the city, give a voice to the issue, make sure that people are informed on what exactly hepatitis C is, how to prevent it, how they put themselves at risk, and stuff like that. And also, only other thing we can do is get out there and make sure that our free community clinics are thriving. If people need to come in and get clean needles and condoms, that should be a very important project that should be initiated. People should be able to come and get free medical checkups and testing for the virus. But as of now, unfortunately, that's all we can lean on. It's very sad to say, because it is a chronic disease and it does have a death rate that is pretty high among the African American community, and the fact that it's attacking our younger generation. We should really consider both of these measures in the public health industry as preventative measures. Um, So here are my references if anyone would like to go back and look at the topics themselves. I really enjoyed looking into the situation, and hopefully you guys also learned a little bit from this presentation yourself. Um, if there's any questions, please feel free to ask them. I am available to answer any questions. Just message me through Canvas or through discussion board, and I will get right back with you. Thank you for listening, and hopefully you guys' projects are coming out good, and I hope everyone is having a wonderful week. Thank you again. Have a good day.